Hi, I'm Dr. Mark Collins of Fort Mojave Dental, and today I'll be discussing obstructive sleep apnea. Do you snore? Do you wake up tired? Are you feeling run down? Do you suffer from headaches, from heart problems, diabetes, depression, stroke, acid reflux, or grinding of your teeth? If you answered yes to any of those questions, you could be suffering from sleep-disordered breathing. The sleep disorders that dentists treat are snoring and obstructive sleep apnea. Snoring is classified as the most moderate manifestation of sleep-disordered breathing, considered an indication of the existence of onset of serious sleep disorders, and greatly affects the sleep of other people. According to the National Sleep Foundation, 110 million adults snored at least a few nights a week. Approximately 80 million snore every night. Snoring is made worse by alcohol use, body sleep position, weight, allergies, or colds. Obstructive sleep apnea is the complete loss of airway patency due to the muscles controlling the soft palate and the tongue relaxing. Patients demonstrate inspiration flow levels while asleep that are less than 50% of what they were when they were awake. An image here shows an open airway and a closed airway, the obstructive airway. The normal airway for men should be 3 cubic centimeters and for women 2 cubic centimeters in diameter. Obstructive goes all the way down to 0 at points in the night. The classification of sleep apnea is the apnea-hypopnea index. That's how many times per hour you stop breathing. 0 to 5 times is normal, 5 to 15 mild, 15 to 30 moderate, and greater than 30 times stop breathing in an hour is severe sleep apnea. How common is it? According to research, 1 in 5 people have obstructive sleep apnea. Over 42 million Americans have it, and 75% of the cases remain undiagnosed. What are the risk factors? Aging, obesity, high blood pressure, smoking, family history, neck size in men greater than 17 inches and in women 15 inches. The symptoms of oral sleep apnea are a lack of energy, morning headaches, hypertension, frequent nighttime urination, depression, obesity, waking up unrefreshed, snoring, nighttime gasping, choking, or coughing, gastroesophageal reflux disorder, teeth grinding at night, restless leg syndrome, and more. What can the oral sleep apnea cause? Alzheimer's disease, cardiovascular disease, insulin resistance, impaired glucose metabolism, impaired endocrine functions, and vascular headaches. It's where the cells in the body die due to a lack of oxygen. So how do we treat oral sleep apnea? With a CPAP, continuous positive airway pressure, surgery, or oral appliance therapy. The CPAP, continuous positive airway pressure, has a 29 to 83% compliance, decreasing per hour of use. Less than 45% tolerance for the treatment, which means less than 45% of the population will actually use the CPAP mask. Some of the side effects of the CPAP are the laceration of the bridge of the nose and wear on the cheeks from the mask, bloating of the stomach, rhinitis, social problems, sore tongue and the gums from being dried out all night, and causing claustrophobia. The surgery is a very expensive procedure. It needs to be redone over time in most cases. It's very painful and less than a 50% success rate. Some examples are tongue reduction, uvuloplasty, and somnoplasty. There are others. What is oral appliance therapy? That's the placement of the mandible in the optimal position for breathing and retention of airway patency, done only by highly trained dentists in dental sleep medicine. Less than 1% of the dentists in the USA do this. Only done after a medical diagnosis is given by the physician. What is an oral appliance for oral sleep apnea? It looks like an athletic mouth guard, but is much less bulky. Holds the jaw gently in a position where the airway can remain open and airflow occurs. Only worn when sleeping. Requires no medicine. It's proven in the scientific literature to be efficacious in helping patients who suffer, and it's FDA and Medicare approved. Some examples of the appliances that we use is the Herbst appliance, which is a Medicare approved appliance, and the Aspire appliance. At this time is not Medicare approved. How is insurance coverage for this? It is not a dental procedure, this is a medical procedure. Therefore, dental insurance does not cover it. But the Medicare and the medical insurance covers it, and in most cases there is no out-of-pocket expense for the patient. If you call our office, we'll be glad to discuss your medical insurance and what we can do for you. We are a friendly office, and we're here to care for you. We are also the first and only facility-approved dental office in the state of Arizona for dental sleep medicine.